Question 1. A patient presents to the emergency department after falling off a ladder while cleaning gutters at home. They sustained a displaced trimalleolar fracture of the right ankle. What is the correct seventh character for the initial encounter for this fracture? I, A, B, D, C, G, D, P. Answer, I, A. This question tests your understanding of the seventh character for fracture care. The keyword initial encounter tells us the patient is receiving active treatment for the fracture for the first time. For a fracture, A represents the initial encounter for a closed fracture or an open fracture. An example would be when a patient first comes in to get their broken bone set or surgically repaired. Remember, A is for active treatment, even if it's not the very first visit if the patient is still in the active healing phase, while D is used for subsequent encounters during the healing process. Question 2. A patient with a history of type 2 diabetes presents with uncontrolled blood sugars and diabetic nephropathy. The provider documented type 2 diabetes with chronic kidney disease due to diabetes. How should this be coded? I, E11, 22, N18, 9. B, E11, 9, N18, 9. C, E11, 22. D, N18, 9, E11, 22. Answer, C, E11, 22. This question focuses on combination codes, specifically for diabetes with complications. The keyword due to diabetes signifies a causal relationship, meaning the nephropathy is a direct result of the diabetes. ICD's 10th CM guidelines state that when a combination code exists for a condition and its associated complication, only the combination code should be reported. The code E11-22, type 2 diabetes mellitus with diabetic nephropathy, fully captures both conditions and their relationship, making a separate code for chronic kidney disease, and N18-9, redundant and incorrect in this context. Always look for a single code that comprehensively describes both the etiology, cause, and manifestation, effect, when a direct link is documented. Question 3. A 65-year-old male is admitted for an acute exacerbation of chronic obstructive pulmonary disease, COPD. He also has documented asthma. How should this scenario be coded? I, J44, 1, J45, 909. B, J45, 909, J44, 1. C, J44, 1. D, J45, 909. Answer, I, J44, 1, J45, 909. This question tests the coding of COPD with asthma, a common comorbidity. The key guideline here is that when a patient has both asthma and COPD, and the COPD is an acute exacerbation, both conditions should be coded separately. While some respiratory conditions have combination codes, asthma and COPD are distinct diagnoses that coexist, and there isn't a single combination code for them. Therefore, you would sequence the code for acute exacerbation of COPD, J44, 1, first, as it's the reason for the encounter, followed by the code for asthma, J45, 909. Question 4. A patient is seen for a routine screening mammogram. The results were normal with no findings. What is the appropriate ICD-10 CM code for this encounter? I, Z12, 31. B, R92, 8. C, N63. D, Z0000. Answer, I, Z12, 31. This question evaluates your knowledge of Z codes for screenings. The keyword routine screening mammogram is crucial because it indicates that the patient presented for preventative care without any signs, symptoms, or personal history of breast cancer. Code Z12-31 is specifically for an encounter for screening mammogram. If the results had been abnormal, you would use a code from our 92-8 for abnormal mammogram findings, but for a normal routine screening, Z12-31 is the correct choice. When coding for screenings, always confirm if it's a routine screening or if there are specific symptoms leading to the test. Question 5. A patient is diagnosed with metastatic carcinoma to the bone from an unknown primary site. Which codes should be reported? I, C79, 51, C81, B. C81, C79, 51, C. C79, 51, D. C79, 51, C79, 9. Answer B. C81, C79, 51. This question tests the sequencing of neoplasm codes when the primary site is unknown. The keyword metastatic carcinoma to the bone from an unknown primary site directs you to the specific ICD-10 cm guideline for neoplasms where the primary site is undetermined. In such cases, code C81, malignant, primary, neoplasm, unspecified, is sequenced first, followed by the code for the secondary site. Therefore, C81 is the principal diagnosis, and C79, 51, secondary malignant neoplasm of bone, represents the metastasis. Question 6. A patient is admitted for dehydration due to vomiting caused by gastroenteritis. Which condition should be sequenced as the principal diagnosis? I. Dehydration. B. Vomiting. C. Gastroenteritis. D. Nausea. Answer C. Gastroenteritis. This question assesses your understanding of principal diagnosis sequencing when a symptom is caused by an underlying condition. The key phrase, dehydration due to vomiting caused by gastroenteritis, indicates a clear cause and effect relationship. According to ICD-10 cm guidelines, when a symptom, dehydration, vomiting, is a manifestation of an underlying condition, gastroenteritis, and the underlying condition is known and treated, the underlying condition should be sequenced as the principal diagnosis. Gastroenteritis is the definitive reason for the patient's admission and is the root cause of the dehydration and vomiting. Question 7. A patient sustained a laceration to the right forearm from a knife in a kitchen accident while preparing dinner. What is the correct external cause code for the activity at the time of injury? I. Y92-010. B. W26-0XXA. C. Y93. G1. D. W45-0XXA. Answer C. Y93. G1. This question tests your knowledge of external cause codes, specifically for activity codes. The keywords a kitchen accident while preparing dinner point to a domestic activity. External cause codes provide additional information about the circumstances of an injury. Y93G1 is the code for activity, preparing food or beverages, which perfectly describes the patient's activity at the time of injury. This code helps to tell a more complete story of the injury event, separate from the cause, knife, or place, kitchen. Question 8. A patient is diagnosed with a urinary tract infection, UTI, due to E. coli. How should this be coded? I. N39-0. B. B96-20. C. N39-0. B96-20. D. B96-20 and 39-0. Answer C. N39-0. B96-20. This question addresses the coding of infections when the causative organism is known. The keyword due to E. coli specifies the infectious agent. ICD-10 cm guidelines state that when a condition, urinary tract infection, N39-0, is caused by a specific bacterial agent, E. coli, B96-20, both codes should be reported. The infection code is sequenced first, followed by the organism code, to fully describe the patient's condition. This provides complete information about both the site of infection and the specific pathogen involved. Question 9. A patient is being seen for a follow-up visit after completing treatment for a fracture of the tibia 2 months ago. The fracture is now fully healed. Which type of Z code would be most appropriate? I. Z09. B. Z47-89. C. Z87-810. D. Z98-890. Answer C. Z87-810. This question evaluates the correct use of Z codes for personal history. The critical phrase, after completing treatment for a fracture. The fracture is now fully healed, indicates that the patient no longer has an active injury, but has a history of one. Z87 810. Personal history of traumatic fracture is the appropriate code to report in this scenario. This code clarifies that the fracture is in the patient's past medical history and is not currently being treated or affecting their current care, distinguishing it from aftercare codes which apply when active healing or care related to the injury is ongoing. Question 10. A patient presents with epigastric pain and is diagnosed with acute cholecystitis with cholelithiasis. What is the correct ICD-10 CM code? I. K8000. B. K81-0. C. K80-10. D. K80-01. Answer I. K80-00. This question tests your knowledge of combination codes for conditions involving the gallbladder. The key phrase, acute cholecystitis with cholelithiasis, indicates that both gallstones, cholelithiasis, and an inflamed gallbladder, acute cholecystitis, are present together. ICD-10 CM provides combination codes for many conditions that commonly occur together. K80-00. Calculus of gallbladder with acute cholecystitis without obstruction accurately captures both the cholelithiasis and the acute cholecystitis in a single code, provided there's no obstruction mentioned. Question 11. A 45-year-old male is undergoing chemotherapy for breast cancer. Which code should be sequenced first for the encounter? I. Z5111. B. C5919. C. Z0000. D. Z41-8. Answer I. Z51-11. This question focuses on sequencing when a patient is receiving active treatment for a malignancy. The phrase undergoing chemotherapy for breast cancer highlights that the chemotherapy is the primary reason for this specific encounter. In such cases, Z51-11, encounter for antineoplastic chemotherapy, should be sequenced as the principal diagnosis. The code for the malignancy, C5919 for unspecified breast cancer, would then be reported as a secondary diagnosis to provide context for the chemotherapy. This sequencing rule applies when the treatment itself is the focus of the visit. Question 12. A patient is diagnosed with essential hypertension and chronic kidney disease, stage 3. The documentation does not specify a causal relationship. How should these conditions be coded? I12-9-N18-3. B. I10-N18-3. C. I10-I12-9-N18-3. D. N18-3-I10. Answer B. I10-N18-3. This question tests your understanding of coding coexisting conditions without a documented causal link. The crucial phrase, does not specify a causal relationship, is the key. When hypertension and chronic kidney disease are both present but the provider does not explicitly link them, you should code them separately. Therefore, I10 for essential, primary hypertension and N18-3 for chronic kidney disease, stage 3 are reported. If the documentation stated hypertensive chronic kidney disease, then a combination code like I12-9 would be appropriate. Question 13. A patient is seen for recurrent major depressive disorder, severe, without psychotic features. What is the correct ICD-10 CM code? I. F33-3. B. F32-9. C. F33-2. D. F32-2. Answer C. F33-2. This question assesses the specificity required for mental and behavioral health coding. The keywords recurrent major depressive disorder, severe, without psychotic features provide all the necessary details to select the most precise code. F33-2 accurately captures a major depressive disorder that is recurrent, currently severe, and does not involve psychotic symptoms. Coding in mental health often requires careful attention to descriptors like recurrent, single episode, mild, moderate, severe, and with / without psychotic features to ensure the highest level of specificity. Question 14. A patient has gangrene of the right foot due to type 2 diabetes. What is the correct sequencing of codes? I. E11, 51, I96. B. I96, E1151, C. E1151, D. R02, E1151. Answer I. E1151 I96. This question tests the coding of diabetic complications and manifestations. The phrase gangrene of the right foot due to type 2 diabetes establishes a clear causal link. ICD-10-CM guidelines instruct that for diabetes with gangrene, a combination code that includes both diabetes and the gangrene should be used first, followed by an additional code for the specific type of gangrene if available. E1151, type 2 diabetes mellitus with diabetic gangrene, is the primary code, followed by I96, gangrene, not elsewhere classified to describe the specific manifestation. Question 15. A patient is seen for a screening colonoscopy. During the procedure, a small polyp is found and removed. Pathology confirms it is benign. What is the principal diagnosis for this encounter? I. Z12-11. B. K63-5. C. D12-6. D. Z86-010. Answer C. D12-6. This question addresses coding for screenings when an abnormal finding is discovered and treated. The crucial information is that a small polyp is found and removed and confirmed benign. According to ICD-10-CM guidelines, when a screening results in a definitive diagnosis, the definitive diagnosis should be sequenced as the principal diagnosis. Therefore, D12-6, benign neoplasm of colon unspecified, is the correct principal diagnosis, as it reflects the condition found and treated. The screening code Z12-11 would not be used as the principal diagnosis in this specific scenario, because the reason for the encounter shifted to managing the polyp once it was discovered. Question 16. A patient is admitted with chest pain and shortness of breath. After workup, the final diagnosis is unstable angina. What is the correct ICD-10-CM code? I20, B. I29, C. R079, D. R0602. Answer I20. This question focuses on coding a specific type of angina. The keywords unstable angina directly point to a precise diagnosis in the ICD-10-CM index. Unstable angina, I20, is a more specific and definitive diagnosis than general chest pain, R079, or unspecified angina, I29. Always strive for the highest level of specificity documented by the provider. Once a definitive diagnosis like unstable angina is established, the initial symptoms leading to the diagnosis are no longer coded. Question 17. A patient presents with a severe headache. After examination, the provider documents headache, likely migraine without aura. What is the most appropriate code? I. G43-909. B. G43-109. C. G43-009. D. R51. Answer B. G43-109. This question tests the coding of uncertain diagnoses when likely is used. The keyword likely migraine without aura indicates that while not 100% confirmed, the provider has indicated a high probability of a specific condition. In the outpatient setting, likely, probable, or suspected conditions are generally coded as if they exist unless specified otherwise by an official guideline. For migraines, G43-109 is the code for migraine without aura, not intractable, without status migrainosus. If it was truly uncertain and required further workup, R51 for headache would be more appropriate, but likely migraine points to a more definitive direction. Question 18. A patient is admitted with sepsis due to a Staphylococcus aureus infection of the urinary tract. How should this be coded? I. A 41-9 N39-0, B95-61. B. N39-0, A41-9, B95-61. C. A 41-2 N39-0. D. A 41-2, B95 61. Answer C. A 41, 2, and 39, 0. This question tests the complex coding of sepsis. The key phrase sepsis due to a Staphylococcus aureus infection of the urinary tract tells us that the sepsis is caused by a specific organism and originated from a specific site. According to sepsis coding guidelines, if the causal organism is known, the code for the specific type of sepsis, G, A41-2 for sepsis due to Staphylococcus, should be sequenced first, followed by the code for the localized infection, and 39-0 for urinary tract infection. In this case, B95, 61, Staphylococcus aureus as the cause of diseases classified elsewhere is not needed because the sepsis code itself, A41, 2, already identifies the organism causing the sepsis. Question 19. A patient is diagnosed with a severe protein-calorie malnutrition. Which ICD-10 CM code should be assigned? I. E43. B. E44, 0. C. E44, 1. D. E46. Answer I. E43. This question focuses on coding specific types of malnutrition. The keyword, severe protein-calorie malnutrition, directs you to the most appropriate and specific code available for this condition. E43, severe protein-calorie malnutrition, precisely describes the patient's diagnosis. It's crucial to distinguish between different severities and types of malnutrition, as E44, 0 and E44, 1 represent moderate and mild, respectively, and E46 is for unspecified malnutrition. Always strive for the highest level of specificity supported by the documentation. Question 20. A patient presents for a follow-up visit after hip replacement surgery for osteoarthritis. The surgical wound is healing well, and there are no complications. What is the correct principal diagnosis? I. Z47, 1. B. T84, 9XXA. C. M16, 9. D. Z98, 89. Answer I. Z47, 1. This question tests the proper use of Z codes for aftercare. The phrase follow-up visit after hip replacement surgery and wound is healing well, no complications indicates that the patient is receiving routine postoperative care. Z47, 1, encounter for orthopedic aftercare following joint replacement surgery, is the correct principal diagnosis for this type of encounter. This C code signifies that the focus of the visit is on the routine care and recovery from the surgery, not on the original condition, osteoarthritis, or any complications. Question 21. A patient is admitted with acute myocardial infarction, MI, involving the anterior wall. This is the first AMI for this patient. What is the correct ICD-10 CM code? I. I2101. B. I219. C. I220. D. I214. Answer I. I2101. This question assesses the specificity required for coding acute myocardial infarctions. The keywords acute myocardial infarction and anterior wall are crucial. I2101 specifically codes for an ST elevation, STEMI, myocardial infarction of the anterior wall, which is the most common type of AMI to involve the anterior wall and is assumed unless otherwise specified. It's essential to select the most specific code that captures the site of the AMI, rather than an unspecified I21-9 or subsequent AMI I22-0 code. Question 22. A patient is diagnosed with recurrent vulvovaginal candidiasis. What is the correct ICD-10 CM code? I. B37-3. B. B37-31. C. B37-32. D. N77-1. Answer C. B37-32. This question evaluates your ability to select specific codes for infectious conditions, particularly those with recurrence. The keyword recurrent vulvovaginal candidiasis is key to choosing the most precise code. While B37-3 represents candidiasis of vulva and vagina generally, B3732 specifically identifies recurrent vulvovaginal candidiasis. Always look for the greatest level of specificity in the code set to accurately reflect the patient's condition. Question 23. A patient presents with generalized essential hypertension. The documentation does not mention any target organ damage. What is the appropriate code? I10, B, I11, 9, C, I12, 9, D, I15, 9. Answer, I10. This question tests basic coding for uncomplicated hypertension. The keyword generalized essential hypertension, without any mention of complications or associated organ damage, directs you to the simplest and most common code for primary hypertension. I10 essential primary hypertension is the correct code when no further specificity or complications are documented. Codes like I11, 9 or I12, 9 are for hypertension with heart or kidney disease, respectively, which are not present here. Question 24. A patient has a family history of colon cancer. They are seeing a physician for general medical examination. What is the appropriate ICD 10 cm code to capture this family history? I. Z80, 0. B. Z89. C. Z83, 71. D. Z86, 010. Answer, C. Z83, 71. This question tests the use of Z codes to document family history. The key phrase, family history of colon cancer, directs you to the appropriate Z code category for family history of malignant neoplasms. Z83, 71. Family history of malignant neoplasm of colon is the specific code that captures this information. This type of Z code is important for risk assessment and preventative care, even if the patient is currently healthy. Question 25. A patient is seen in the outpatient clinic for administration of a tetanus toxoid vaccine. What is the principal diagnosis? I. Z23. B. Z23, 3. C. T88, 1XXA. D. Z0000. Answer, I. Z23. This question focuses on coding for prophylactic vaccinations. The phrase administration of a tetanus toxoid vaccine clearly indicates the primary reason for the encounter. According to ICD 10 cm guidelines, Z23, encounter for immunization, is the correct principal diagnosis when the patient is seen solely for immunization. The specific type of vaccine is further detailed within the Z23 category, e.g., Z23-3 for tetanus. This Z code highlights that the purpose of the visit is preventative, rather than treating an illness. Question 26. A patient is diagnosed with severe persistent asthma with acute exacerbation. Which code accurately describes this condition? I. J4550. B. J45901. C. J4551. D. J45909. Answer, C. J4551. This question tests your ability to code specific types of asthma with greater detail. The keywords severe persistent asthma and acute exacerbation are crucial for selecting the most precise code. J4551 specifically represents severe persistent asthma with acute exacerbation, encompassing both the severity and the current state of the condition. Coding asthma requires careful attention to its type, intermittent, mild, moderate, severe persistent, and whether it is an exacerbation or has status asthmaticus. Question 27. A patient presents with a laceration to the left hand from a power saw in their garage. What is the appropriate place of occurrence code? I. Y92000. B. Y92013. C. Y92020. D. Y92010. Answer, D. Y92010. This question focuses on external cause codes, specifically for the place of occurrence. The keyword garage tells us where the injury happened. External cause codes provide supplementary information about how and where an injury occurred. Y92010 is the specific code for garage in single-family house as the place of occurrence of the external cause. These codes are important for public health and injury prevention statistics. Question 28. A patient is diagnosed with alcohol dependence with withdrawal without delirium. What is the correct ICD-10 CM code? I. F10-231. B. F10-230. C. F10-129. D. F10-920. Answer B. F10-230. This question evaluates your coding knowledge for substance-related and addictive disorders. The keywords alcohol dependence, withdrawal, and without delirium are all essential for selecting the most accurate and specific code. F10-230 precisely captures alcohol dependence with withdrawal without delirium. It's critical to note the level of dependence, use, abuse, dependence, and any associated complications, withdrawal, intoxication, delirium, psychotic disorder, for accurate coding in this chapter. Question 29. A patient with osteomyelitis of the right femur is seen for chronic, non-healing wound care following a surgical debridement completed 2 months ago. What is the appropriate principal diagnosis? I. M86-651. B. L97-419. C. Z48-01. D. Z48-818. Answer I. M86-651. This question tests the coding of chronic conditions requiring ongoing treatment. The phrase osteomyelitis of the right femur is seen for chronic, non-healing wound care indicates that the osteomyelitis is still an active, ongoing condition requiring direct management. Therefore, the code for the osteomyelitis, M86-651, chronic osteomyelitis, right femur, should be the principal diagnosis. While wound care, Z48-01, is performed, it is a treatment for the active infection, not the primary reason for the visit in the context of the underlying active disease. Question 30. A patient presents with bilateral carpal tunnel syndrome. How should this be coded? I. G56-00. B. G56-01. G56-02. C. G56-03. D. G56-09. Answer C. G56-03. This question tests your understanding of laterality and combination codes. The keyword bilateral carpal tunnel syndrome is key. While you might initially think to code the left and right sides separately, ICD-10 often provides specific codes for bilateral conditions. G56-03 is the combination code for bilateral carpal tunnel syndrome, which is more specific and appropriate than coding each side individually or using an unspecified code. Always check for a bilateral option when a condition affects both sides of the body.